Part A. Extract 1. Questions 1 to 12. You hear a general practitioner talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. Please come in. I understand you're here because of a persistent cough. Can you tell me when this all started?
Good morning, doctor. Yes, it's been quite bothering. I first noticed the cough about 2 months ago. It started mildly, but it's just not going away.
I see. And what other symptoms have you been experiencing along with the cough?
Well, I've been feeling really tired more than usual. And sometimes I get a low-grade fever, especially in the evenings. I've also noticed some shortness of breath when I exert myself, like climbing stairs.
Has the cough changed over time, Mihira? Is it dry or productive?
Initially it was dry, but now it's often productive with some clear phlegm. It's worse in the mornings and at night. I tried some over-the-counter cough syrup and lozenges, but they don't really help much anymore.
Before coming to me, did you consult anyone else or have any tests done for this?
Yes, I saw my family doctor a month ago. They thought it might be a viral infection that's just lingering. They ordered a chest x-ray which came back clear and some routine blood tests, but nothing specific was found.
All right. Can you tell me about any previous medical conditions you have?
I have seasonal allergies which I manage with antihistamines. And I had a bout of bronchitis a few years ago, but it cleared up completely. Other than that, I'm generally healthy.
Okay. Thank you, Mihira. Given the persistence of your symptoms and the clear x-ray, I'd like to explore other possibilities. I'll order a sputum culture to check for any bacterial presence, and we might consider pulmonary function tests to assess your lung capacity.
Okay. I just want this cough to go away. It's affecting my sleep and my work. I can't focus properly.
I understand. It sounds very frustrating. Based on your symptoms and the history, it could be a post-viral cough, or perhaps asthma is contributing, especially with the shortness of breath. We need the test results to confirm.
So what can we do in the meantime? I've tried so many different cough remedies.
Once we have the test results, we can establish a targeted treatment plan. For now, I would suggest continuing with saline nasal rinses if you have any congestion.
To effectively manage your condition, if it turns out to be asthma or a persistent infection, we'll likely need a multifaceted approach. Mihira, this could include anti-inflammatory medications.
And what specific medications are you thinking of?
That's a good question, Mihira. We might consider prescribing an inhaler, perhaps a bronchodilator to open up your airways, and potentially a short course of oral steroids if inflammation is significant.
I'm really worried about long-term effects. Is there anything I should take care of?
That's a valid concern. I'd advise you to avoid dusty environments and strong irritants like smoke. These can exacerbate coughs and respiratory issues.
Mihira, we should have the sputum culture results back in about 3 days, and we can schedule the pulmonary function tests next week. We'll arrange a follow-up appointment after that to discuss everything.
I really hope this helps. Thank you, doctor.
Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How have you been feeling since your last visit after your knee surgery?
Good morning, Liam. Well, there is pain around the knee and I'm still struggling with stiffness, especially when I try to bend it. I'm also finding it hard to walk without a slight limp, and I feel quite weak on that side.
I see. That's common after knee surgery, Mihira. Has the swelling reduced since last time, or has it remained fairly consistent?
The swelling has gone down significantly, which is good. But it just feels tight, especially in the mornings, and it really limits how much I can bend my knee. I'm worried I won't get my full range of motion back.
That's understandable, Mihira. Regaining full mobility after knee surgery takes time and consistent effort. Let's review your treatment so far. You've been doing the quadriceps sets and gentle knee bends, right?
Yes, I've been doing the ones you showed me, the quad sets and heel slides, 3 times a day as you suggested. I also do the ankle pumps to help with circulation. They seem to help a little with the stiffness, but I still can't bend my knee fully.
That's good to hear, Mihira. Those exercises are crucial for activating the muscles around your knee and improving joint mobility. Are you continuing with the swelling management we spoke about?
Yes, I use ice packs regularly, especially after doing my exercises. It helps keep the swelling down, which makes the knee feel a bit more comfortable.
Great, it sounds like you're sticking to the plan. Now, let's go over a bit of your history to see if anything might be contributing to this persistent stiffness.
Well, I had an ankle sprain about a year ago on the same leg. It healed, but I sometimes feel a bit unstable there. And I had shoulder surgery 5 years ago, but that's a different area entirely.
Alright. Mihira, it's possible that your leg muscles might have developed compensatory patterns, which could be impacting your knee recovery now. Based on what you've described, it sounds like there's been some improvement in your overall strength, which we call enhanced muscular endurance. But we'll need to evaluate your progress with a few more tests.
That makes sense. What kind of tests do you have in mind?
I'd like to perform a knee flexion measurement to assess your current range of motion, as well as a balance test to determine your stability on that leg. Mihira, we may also consider a gait analysis to observe your walking pattern in more detail.
Okay, that sounds helpful. Will we need to adjust my treatment based on the test results?
Possibly yes. If we find that limited flexibility or muscle imbalance is a factor, Mihira, we might add some manual therapy to your sessions. I may also recommend you start with lightweight bearing exercises, like partial squats, in addition to the ones you're already doing. These will help build strength and improve stability around the knee joint.
Alright, I'll give it a try. Is there anything I should avoid doing in the meantime?
Yes, Mihira, avoid any high-impact activities, deep knee bends, or twisting motions on the affected leg, as they can put excessive strain on your healing knee. Also, listen to your body. If you feel any sharp or increasing pain, stop the activity immediately.
Got it. I'll be careful.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Question 25. You hear a physiotherapist called Mihira talking to a patient. Now read the question.
Good morning, Mr. Harrison. Let's talk about your activity levels. How are you feeling after our last session?
A bit clearer, Mihira. Still some stiffness, but less of that gnawing ache. I'm just confused about what I can and cannot do. My neighbor mentioned her psoriasis flared up after she started a new exercise regime, and she thought it might be linked to dairy. I've always been dairy sensitive, with the occasional dermatitis.
Right. Psoriasis is quite different from your arthrosis, Mr. Harrison. While some find dietary changes helpful for inflammatory conditions, our primary focus for your knee is controlled movement. Did you try the gentle knee bends?
I did, and felt a twinge. Not like the sciatic pain I had years ago, thankfully. My wife keeps suggesting I cut out all nightshades. She read it helps with osteoporosis. Apparently, they cause inflammation.
Osteoporosis is about bone density, distinct from the cartilage where we're managing. For your knee, rigorous impact activities are out for now. Think low impact, swimming, cycling, brisk walking, but absolutely no running or heavy squats. We need to prevent further irritation. The key is gentle, consistent loading, not eliminating entire food groups unless there's a clear medical diagnosis linking it to your joint health. Your initial issue is overuse, not an autoimmune response.
So Mihira, no strict diet, just sensible movement? What about my occasional gastritis? Could the paracetamol affect that?
We can discuss pain relief with your GP. For now, movement is therapy.
Question 26. You hear a nurse called Mihira talking to a doctor. Now read the question.
Doctor, regarding Mrs. Davies in room 302, the leg ulcer. I was reviewing the dressing order and noticed a note about potential dermatitis around the wound edge. Should we stick with the hydrocolloid or consider something different?
Good observation, Mihira. We need to be careful. Her history includes a previous adverse reaction to a silver dressing, remember? Not full-blown necrotizing fasciitis, thankfully, but a significant allergic contact dermatitis that complicated healing. The hydrocolloid is generally fine for exudate, but if the surrounding skin is getting irritated, we could exacerbate the existing sensitivity.
Exactly my thought. I was considering a non-adherent silicone foam. It's gentler, and we're trying to prevent any peri-wound maceration, which could also look similar to a contact reaction if we're not careful. The wound bed itself looks good. No signs of streptococcal infection that would warrant topical antibiotics.
That's a sensible approach. A silicone foam would be ideal. It provides cushioning, manages moderate exudate, and critically, minimizes trauma during changes. We really want to protect that fragile peri-wound area from any further insult. Let's make sure we document the change and her skin reaction history clearly.
Will do. I'll update the care plan immediately. And just to confirm, we're not looking at any debridement yet, correct? The SLU is minimal.
No, Mihira, not yet. Conservative management is key for now.
Question 27. You hear a pediatrician called Mihira conducting a ward meeting. Now read the question.
All right, team, let's discuss young Liam in bed 4. He's 3 years old, admitted with persistent cough and some wheezing. Initial concerns were bronchiolitis, but his CRP is still elevated. Nurse Patel, what's his latest OBS?
Temperature 38.5, SATs are fluctuating between 92 to 94% on air. Still has that harsh, barking cough, but less of the high-pitched stridor we heard yesterday. His mother mentioned a recent family trip and some unusual contact.
Interesting. We ruled out typical viral croup yesterday due to the lack of improvement with steroids. The chest X-ray showed some peribronchial thickening, but nothing indicative of a large pneumothorax. Given the travel history and persistent inflammation, despite the milder respiratory distress, we need to consider something beyond a standard respiratory virus. We've seen a few atypical presentations lately. Could be related to exposure to environmental allergens, or perhaps an early onset of a less common, though not necessarily severe, pertussis variant that's just presenting atypically in this age group.
So Mihira, not just a lingering viral infection then. What about the epiglottitis protocol?
No, his airway isn't compromised to that degree, and the cough profile doesn't fit. The key here is the persistent cough and the subtle but ongoing inflammatory markers, along with that travel history. We've initiated the atypical respiratory panel. We need to consider something that might not clear up with standard supportive care for a common cold or flu. Let's isolate him as a precaution and ensure strict hand hygiene.
Understood, doctor.
Question 28. You hear an oncologist, Mihira, talking to a social worker. Now read the question.
Good morning, Peter. I wanted to follow up on our idea for a support program for carers. I'm seeing an increasing number of families where the primary carer is visibly struggling, often exhibiting symptoms similar to burnout, but they attribute it to simple fatigue.
Absolutely, Dr. Mihira. It's a critical area. Many feel isolated, sometimes developing anxiety or even symptoms resembling depression, which they often dismiss as just being tired. We've had a few instances where carers neglected their own health because of the demands. One even mentioned insomnia, so severe it was impacting their ability to administer medication correctly.
Precisely. It's not just about managing the patient's physical needs. The emotional toll of navigating a diagnosis like lymphoma or leukemia, and the complexities of treatment, can be immense. We need to help them process the grief, fear, and practical challenges. It's about building resilience, not just teaching coping mechanisms. I envision something that fosters peer support and validates their emotional experience, offering strategies for self-care. It's not a bereavement counseling group, though that's also vital later on. This is proactive.
Mihira, a structured space for them to share and receive psychoeducation, not just general information on palliative care, but really focusing on their psychological well-being. We could incorporate mindfulness exercises, and perhaps a segment on navigating complex family dynamics, which often arise during prolonged illness.
Exactly. They need to feel seen and heard before they reach a breaking point.
Question 29. You hear a pharmacist called Mihira talking to a patient. Now read the question.
Good morning. What can I help you with today?
Hi, Mihira. I'm going on a cruise next week, and I always get terribly seasick. Last time, I tried some over-the-counter tablets, the ones for general nausea, but they just made me drowsy and didn't really stop the vomiting. I think they were for something like gastritis, not motion sickness specifically.
I understand. Many general anti-nausea medications aren't potent enough for significant motion sickness, and the side effects can be problematic. Have you ever tried anything stronger, like a transdermal patch? We have scopolamine patches, which are very effective for preventing motion sickness, working directly on the inner ear signals.
I heard about patches, but my friend said they gave her blurred vision and a dry mouth, almost like she had glaucoma. And another friend swore by ginger, but I've always had issues with heartburn, so I'm wary of anything acidic. I just want to enjoy the trip without feeling like I have vertigo the whole time. My doctor mentioned something about my inner ear balance being a bit sensitive.
Yes, the scopolamine patch can have those anticholinergic side effects, though they are usually mild. Ginger can be helpful for mild nausea, but it's often not sufficient for severe motion sickness, and you're right, it could exacerbate heartburn. For strong prevention, especially if your inner ear is sensitive as you say, the patches are generally the most reliable option despite minor side effects, as they offer continuous release. Oral medications often require careful timing. If you're concerned about side effects, we can discuss taking the patch off earlier if symptoms subside, or pairing it with a non-drowsy antihistamine for mild cases.
So the patch is really the best bet for prevention?
For significant motion sickness, yes, it's typically the most effective preventative measure we have.
Question 30. You hear a head nurse called Mihira talking to a doctor. Now read the question.
Doctor, about our morning round strategy. I'm finding that the time spent on each patient varies wildly, and we're often getting bogged down by minor issues that could be handled differently. For instance, Mr. Davies in bed 7 keeps asking about his discharge papers, confusing them with his daily care plan. It's taking up valuable doctor time.
I agree, Mihira. And then there's Mrs. Khan in bed 12. Her dementia often leads to repetitive questions about her diagnosis, which, while important, shouldn't disrupt the flow for acute cases. We also had that hiccup with the new registrar mistaking a sepsis alert for a routine chest infection last week, which highlighted a need for clearer, concise updates.
My concern is that while we're addressing individual patient needs, we're losing efficiency and potentially delaying critical assessments for others. I've been thinking about a structured handover before rounds, ensuring doctors receive a succinct, prioritized update focusing on new developments or urgent concerns, not just a full history readout. This would allow for more targeted bedside discussions. We need to streamline our communication. It's not about cutting corners on patient interaction, but about optimizing how we interact during rounds.
That makes sense, Mihira. So, a quick, focused briefing. Less narrative, more actionable points. And perhaps the nursing staff can handle routine queries like discharge dates or dietary restrictions beforehand, rather than escalating them to the doctors on rounds, unless there's a medical complication.
Exactly. That way, when you reach the bedside, the focus is immediately on the medical management and patient progress, not administrative details or clarifying past information. It will allow you more time for complex cases and help us keep to a schedule for medication rounds.
Part C. Extract 1. You hear a cardiologist, Mihira, and an interviewer discussing new generation lifestyle plan.
Welcome, Dr. Mihira. Thank you for joining us today. We're eager to learn about this new generation lifestyle plan you've been championing. Can you start by explaining what exactly it entails?
Thank you for having me. The New Generation Lifestyle Plan, or NGLP as we call it, is fundamentally a highly personalized, data-driven approach to cardiovascular health. It moves beyond generic dietary guidelines and exercise recommendations to leverage individual biomarkers, genetic predispositions, and even microbiome analysis. So instead of a blanket recommendation to eat less fat, We're looking at specific fatty acid profiles, inflammatory markers, and how an individual metabolizes different macronutrients. It's about precision wellness, tailoring interventions to a person's unique physiological landscape to optimize outcomes and prevent disease progression.
That sounds incredibly advanced. Mihira, how has this evolved from previous, perhaps more conventional, approaches to lifestyle modification in cardiology?
It's a significant evolution. Historically, our advice was broad: reduction in saturated fats, increased physical activity, smoking cessation. While effective to a degree, these were largely one-size-fits-all directives. The NGLP has been refined through advancements in genomics, metabolomics, and wearable technology. We've gained a much deeper understanding of individual variability in disease susceptibility and response to interventions. For instance, we now understand that while statins are beneficial for many, lifestyle adjustments can be meticulously crafted to achieve similar or even superior lipid profiles in specific individuals, reducing reliance on pharmaceuticals or enhancing their efficacy. It's a continuum, constantly integrating the latest scientific insights to refine protocols.
Mihira, given its complexity, how effective are you finding this plan in practice? Are you seeing tangible benefits for patients?
Absolutely. The efficacy has been truly encouraging. We're observing more pronounced reductions in cardiovascular risk factors, lower HbA1c, significant improvements in lipid panels, and sustained weight management, often without the common plateaus seen with less individualized plans. Beyond objective markers, patients report dramatically improved energy levels, better sleep quality, and a profound sense of empowerment. It's not merely about disease management. It's about enhancing overall vitality. Patients feel more engaged because they understand the why behind each recommendation, seeing direct correlations between their actions and their unique biometric data. This personalized feedback loop drives adherence and superior results.
It sounds highly effective. But Mihira, how adaptable is such a tailored plan for the average person, or indeed, for varied patient populations?
That's a crucial point. While highly personalized, the NGLP is designed for adaptability. The framework is flexible. The core principle is continuous assessment and adjustment. For example, for someone with limited access to specific fresh produce, we focus on identifying equivalent nutrient profiles from available sources. For patients with demanding work schedules, we integrate micro-workouts or stress reduction techniques that fit their routine. It's not about imposing an ideal, but about co-creating a sustainable plan that respects their lifestyle, cultural preferences, and socioeconomic realities. The plan evolves with the patient, making it universally applicable, albeit with individual variations. It's not a rigid prescription, but a dynamic partnership.
In terms of traditional versus this new generation approach, Mihira, what would you highlight as the most significant differentiator beyond the personalization?
The most significant differentiator is the proactive, predictive element. Traditional approaches were largely reactive: treat high blood pressure, manage diabetes. The NGLP is designed to prevent the onset or progression of these conditions by identifying individual vulnerabilities early, sometimes even before symptoms manifest. It shifts the paradigm from disease management to true health optimization. We're intervening at a subclinical level, using advanced diagnostics to anticipate risks and implement preventive strategies tailored to that individual's unique biological blueprint. It's moving from general population-level advice to targeted, individual-level health forecasting.
Finally, Dr. Mihira, with such a rapidly evolving field, how do you and your team ensure you're continuously educated and up-to-date with the latest research and technologies in this new generation approach?
Continuous education is paramount. Our team is actively involved in multidisciplinary peer-reviewed journals, participating in international conferences, and engaging in collaborative research. We also have regular internal seminars where we discuss emerging evidence and refine our protocols. Furthermore, a significant component involves direct engagement with geneticists, nutrition scientists, and data analysts. It's a perpetual learning curve, driven by curiosity and the commitment to offer the most evidence-based, effective care. We actively encourage each team member to specialize in an area, fostering a culture of shared expertise and ongoing professional development.
Extract 2. Questions 37 to 42. You hear a microbiologist talking about lab procedures at the Mihira Research Institute.
Good morning, everyone. It's a privilege to speak to you today from the Mihira Research Institute, a cornerstone of Mihira Care's commitment to cutting-edge medical science. Our high-tech microbiology laboratory is at the forefront of diagnostic innovation and pathogen research. We've invested heavily in automation and advanced molecular techniques, allowing us to process thousands of samples daily with unparalleled accuracy and speed. From next-generation sequencing platforms to highly sensitive mass spectrometry for pathogen identification, our facility is designed to push the boundaries of what's possible in infectious disease diagnostics. This dedication to state-of-the-art technology is fundamental to delivering the exceptional standard of Mihira care our patients expect. Now, regarding the internal organization of our lab department, it's structured for both efficiency and specialization. We operate across several key divisions: clinical bacteriology, mycology, virology, parasitology, and a dedicated molecular diagnostics unit. Each division is headed by a lead microbiologist with specific expertise, fostering deep knowledge within their respective fields, while also ensuring seamless collaboration. For instance, a complex case might involve input from both our virology and molecular teams to confirm a novel viral strain. Specimen reception and processing are highly centralized to maintain strict chain of custody and minimize pre-analytical errors, guaranteeing the integrity of every sample received under the umbrella of Mihira Care. This modular yet integrated design allows us to respond rapidly to emerging threats. The primary functions of our department extend beyond mere pathogen identification. We are critically involved in antimicrobial susceptibility testing, guiding clinicians in selecting the most effective treatments, which is vital in combating antimicrobial resistance, a global health crisis. Furthermore, we conduct robust infection control surveillance within all Mihira Care facilities, actively monitoring healthcare-associated infections and providing crucial data for preventative strategies. Our role also encompasses the development and validation of new diagnostic assays. It's a constant push for improved sensitivity and specificity, allowing for earlier and more precise diagnoses, ultimately enhancing patient outcomes throughout the Mihira Care network. Our ongoing research initiatives are truly dynamic and diverse. Currently, we have several pivotal projects. One focuses on understanding the genomic epidemiology of multi-drug-resistant organisms prevalent in our region, aiming to identify transmission pathways and inform targeted interventions. Another project is exploring novel rapid diagnostic platforms for detecting atypical pneumonia pathogens, significantly reducing diagnostic turnaround times from days to hours. We're also collaborating on a project investigating vaccine effectiveness against evolving viral strains using advanced serological profiling. These research endeavors are integral to our mission at Mihira Research Institute, constantly striving to advance scientific knowledge and enhance public health through Mihira Care initiatives. The impact of our work on common people, beyond the immediate clinical diagnostics, is profound. By swiftly identifying pathogens and their resistance patterns, we enable clinicians to prescribe appropriate antibiotics, preventing prolonged illness, reducing hospital stays, and mitigating the spread of resistant infections within the community. Our surveillance efforts directly contribute to safer hospital environments for everyone seeking Mihira care. Moreover, our research feeds into global health strategies, influencing vaccine development and public health policy, effectively protecting broader populations from future outbreaks and enhancing overall community resilience against infectious diseases. We believe this broader impact is a testament to our commitment. Finally, regarding the security of our department, it is paramount. We handle highly sensitive biological materials and patient data, so our protocols are rigorously enforced. Access to the lab is strictly controlled through multi-factor authentication systems. All laboratory personnel undergo extensive biosafety training, covering handling of hazardous materials, spill containment, and emergency procedures. Data security is equally stringent. All patient information is anonymized where possible and stored on encrypted servers, compliant with national and international privacy regulations. Furthermore, we adhere to biosafety level 2 and 3 containment standards where appropriate, ensuring the safety of our staff, the public, and the integrity of our research. At Mihira Care, security is non-negotiable.